Hey guys, this is Trenton Raymond here from Freedom Physical Therapy. I'm a physical therapist, and I just wanted to talk to you today about fibromyalgia and kind of the disorder and how we treat it and kind of see it. So it's a diagnosis that we treat here at Freedom Physical Therapy, but I don't know if a lot of people understand kind of what it is in the general public. So based on the Mayo Clinic definition and what we typically treat it as is it's a disorder with diffuse kind of widespread musculoskeletal pain, but people also get symptoms like fatigue, sleep disorders, mood issues, and memory issues. So basically what happens is you have a very heightened sensory system. So things that normally don't hurt, like light touch, they might begin to be perceived as pain. Other things like, like a normal paper cut or stubbing your toe are no longer minor, they're very extreme and kind of a heightened response. So we at Freedom are trained in certain techniques that are supported by research to help bring those pain thresholds down, or I should say raise them back up, so that things aren't as heightened in their response and we can get you moving and feeling better. In the video before, I described kind of what fibromyalgia is, and as the research comes out, there's more and more evidence supporting some hands-on techniques to help reduce those pain levels and help you move better to help manage that pain. One technique we use is dry needling. So the process involves inserting a small acupuncture-like needle into the tissue into a trigger point to help cause increased blood flow and decrease some of those pain responses. So I'm going to demonstrate that today. So first we have our needle. And in your patient, you'll find an area of banded tissue or restricted kind of muscle. And once you find that, and it kind of reproduces that patient symptom, you will insert the needle and slowly find your depth. And right there we get a couple nice twitches. And then we take the needle back out and we put pressure on that spot to help with some of that post-needling soreness that some people get. The idea is that after we needle, there will be less tension in that muscle, and as the blood flow kind of gets increased to the area, there will be some stimulated healing and a better environment for your body to improve its pain. Earlier we talked about fibromyalgia and how the pain levels can be exaggerated and very heightened. And there's some hands-on techniques that evidence has shown can help reduce those pain levels and help you move better. One of them is called myofascial release. So basically what we're doing is trying to increase the mobility of the tissues between the skin and the muscle. And it's a connective tissue that as you stretch it, it can kind of start to move better and lengthen to create a more healing environment. So I'll show you 3 techniques today of how us as PTs can help promote that healing and reduce pain. So the first one is kind of a stacked technique of sustained hold. So I'm going to take up the tissue and just feel if there's any restriction one way or the other. You can see it glides better towards me, so I'm going to go actually away from that into the restriction a little and hold. Now our connective tissue actually works in more than one plane at a time, so I can actually add side to side and even some twisting. And you just hold for 60 to 90 seconds to get a good release. Some people will even hold up to 2 minutes. And then work our way back out of the restriction. The second technique is more of a spreading technique. So you grab opposite sides of that tight tissue and you push away and hold when the tissue stops moving. And you'll hold until you feel the tissue want to give way, and you take up the slack and continue holding. And last but not least is a skin roll technique, where you bunch up the skin and you roll it all the way up through those fascial planes and those connectors. And if you get a good spot that's nice and tight, you can even start to jar it and lift. All right, so those are some of the techniques that we use for the myofascial release. And hopefully, if you or anybody you know thinks you could benefit from it, come on in and see us.